Trachea is palpable in the suprasternal notch, as I said before, midway between the two clavicle. So we have a two clavicle here. Here is a suprasternal or jugular notch, and we can palpate the trachea back of this notch. Another soft landmarks of the thorax is a different line like mid-clavicular, mid-axillary and scapular line that I'm going to show you this line in this picture. As you can see here, we have a upper border of the body of the vertebrae T1 or first thoracic vertebrae or spine of the seventh cervical vertebra here, and we have a lower border of the vertebral 12 here, and on each side of the 12 thoracic vertebrae we have a 12 rib here on right side and left side. So we have a right line in the right side and the left line in the left side that covered with a pleura that is here with a bold line that covers the left and right line. Mid-clavicular line is one of the soft tissue landmarks of the thorax. Mid-clavicular line or lateral verticular or mammary plan. It is a vertical plan passing through the mid-inguinal point, the point of ninth costal cartilage and the middle of clavicle. Mid-axillary is another line of the thoracic. Mid-axillary line, it passes vertically between the two folds of the axilla. And a scapular line in the posterior aspect of the thorax is passed vertically along the inferior angle of the scapula. So in this section we learned a lot about bony of thoracic cage and the boundaries of the thoracic cage, superior and inferior aperture of the thorax, and the bony landmarks, soft tissue landmarks of the thorax. That is very important here. So I'm going to show you about these pictures. We have a superior mediastinum here, an inferior mediastinum here. At the anterior we have a sternum, manubrium of the sternum, body of the sternum and xiphoid process of the sternum. And the back we have a 12 through 1 to 12 vertebrae. The superior mediastinum is separated from the inferior mediastinum through the transverse anterior posterior plan that is goes through sternal angle to the disc between 4th and 5 vertebral. In the inferior mediastinum we have a heart, and then we have a three separate space: posterior, middle and anterior mediastinum. So inferior mediastinum separated to three parts: one in green, two in middle and three in the posterior. So anterior mediastinum, middle mediastinum and the posterior mediastinum are all three parts of the inferior mediastinum. So about the landmarks of the thorax, I'm going to show you. Here is a sternum, it's the body of the sternum and the manubrium. It's a sternal angle or angle of Lewis. We have a second costal cartilage, second rib here, and the second intercostal space. We can count the rib from here to the downward and lateral. And in the behind the sternum we have a base of the heart that lies behind the sternum. Here is the first part of the aorta, ascending aorta. that is related to the sternal angle. Here is the begins and ends of the arc of aorta and begins of the descending aorta that's related to the sternal angle or angle of Lewis. So angle of Lewis is very important landmarks of the trunks. Here is a pulmonary trunk artery. It lies lateral next to the aorta. That pulmonary artery is divided to the right and left branches at the level of the angle of Lewis. So you can hear the trunca divide into the right and left bronchi at the level of the angle of Lewis. And here is the arc of aorta that is arcing from the angle of Lewis from the anterior to the posterior. And we have a pulmonary trunk here that's divided to the right and left artery at the level of and blue of the at the level of the angle of Lewis. And here is and back of the trunk on azygos, back of the trunk on esophagus, we have azygos vein that is arcing from back to the anterior, posterior to the anterior, to reaching to the right line. So sternal angle or angle of Lewis is very important, and one of the most important bony landmark of the trunks. We can use this angle and other landmarks to find out structure inside the trunks. In the next section, I will teach you about each ribs and divided the ribs to typical and atypical ribs, and we will learn more about a different part of the ribs with details.